Good morning and hello and welcome to another video. Today I thought I will go through a very popular MRCOG Part 3 exam station with you. This is talking about different surgical instruments that are used here in the UK, and this station has come up a lot repeatedly in MRCOG Part 3 exam. So I hope you'll benefit from this as we're going to go through all the different various instruments one by one. Right, so this is the first surgical instrument. I want you to have a look at it properly and come up with with what you think it is, and that's how we're going to run this presentation. So I will show you the instrument. I want you to think about an answer. I want you to also think about where we use it and why, and then the following slide will identify the instrument. Right, so this is called a Ramsay's forceps. Now this is used to grasp tissue. You may recall this to be tooth or non-tooth, and it's probably something you ask all the time when you perform your abdominal surgeries. Right, so this is our next instrument. Please have a look closely at it and think about what it is and what can it be used for. Right, so this is a Babcock tissue forceps. Now, you may recall using this when you perform, for example, surgical sterilization, and this is something that you would hold your fallopian tube with. Okay, this is the third surgical instrument. This is a needle holder. Right, so this is our next instrument. Please have a look and think about the answer. Right, and this is the Littlewoods tissue forceps. Now this is again used to hold layers of tissue. This is something you may have encountered while doing a caesarean section to hold the rectus sheath, for example. This is our next instrument. What do you think this is called? This is a Lane tissue holding forceps. Right, moving on to our next instrument. I hope as obstetricians and gynecologists you have used this instrument at some point in your career. Right, this is a Rampley sponge holding forceps. Now this is used, for example, to hold on to the membranes after delivery of the placenta at the time of C-section or even after vaginal delivery. It's used for various different reasons, but that's one common reason that comes to mind. Okay, this is our next instrument. So this is called a Doyne's retractor. Again, something you may have used to pull the bladder out of the way while doing a hysterectomy, for example, or while doing a caesarean section more commonly. This instrument is used here in the UK. Right, so look at this instrument, look at the jaws of this instrument. What do you think this is? It's not something that's very commonly used, so think about the answer. It's a Kocher artery forceps. So it's a hemostatic clip used to hold onto an artery before you're able to tie it. Right, moving on to our next instrument. Now again, this instrument is something that's very commonly used during a caesarean section here in the UK. Right, this is a green Armitage uterine hemostatic forceps. Right, moving on to our next instrument. This is a Spencer Wells artery forceps. Again, something very commonly used both in obstetric and gynecological surgery. Okay, this is a type of scissors, as you can see, but what is it called? This is a McIndoe's tissue dissecting scissors. Right, what are these called? Something you may have used before doing hysteroscopy or surgical evacuation in order to dilate the cervix. This is called Heger's dilators. They come in different sizes, as you can see from the picture, and they're usually used to dilate the cervical canal and the internal os, including the external os, in order for you to instrument the uterus. Right, what is this instrument called? Again, something you may have seen quite commonly and also used in your practice. Right, this is a curette. Now this is commonly used to, for example, obtain a uterine biopsy to curette the uterus. You may use it at the end of, for example, a surgical evacuation to make sure all of the walls of the uterus are empty. Right, what is this instrument called? This is an Alice. Now you may have used this instrument while repairing an anal sphincter, so like a third-degree tear, where you've held the edges of the sphincter using this forceps. Right, this is also a type of scissors, as you can see, but what are they called? So these are Mayo scissors. Well, thank you so much for listening. If you have followed me so far, I hope you found this video useful. Don't forget, I do offer you a preparation for the MRCOG Part 3 revision course as well, where we do practical stations live in the time format of the exam, so you're able to practice it in real time, and I'll be able to give you feedback at the same time as well. If you've got any questions, if you found this video useful, please don't forget to give it a thumbs up and subscribe to my channel if you haven't already. Also check out the MRCOG Part 2 revision notes that I summarize the guidelines and the TOG articles, and I've got these in separate PDF formats available for you, and this copy can be yours if you'd like one. Good luck revising for your Part 3 exam. I know some of you may be waiting for your Part 2 exam results tomorrow. I wish you all the best.